Hey guys, it's Ellisa and I want to go over our COVID-19 update dated August 17th from Shasta County Health and Human Services. I'm going to read through the highlighted bullet point very quickly because we're going to break it down in a minute. Myth. The only important numbers are hospitalizations and deaths. Fact. Recovery from COVID-19 can take a long time, even in young adults with no chronic health conditions. The CDC reports that 1 in 5 previously healthy adults weren't back to their usual health 14 to 21 days after testing positive, while 90% of people with influenza recover within 2 weeks of a positive test. We're learning more about this novel virus every day, but lung damage, heart damage, blood clotting, and other long-term problems are being seen in some former COVID patients. Let's break this down. So starting with the myth, they said the only numbers that matter are hospitalizations and deaths. That's something you've probably heard in our Board of Supervisors meetings from public comment. And they counter it with a fact. Recovery from COVID-19 can take a long time, even in young adults with no chronic health conditions. So first of all, it's not a direct counter to the myth, but I'm going to revise that fact for you anyway. Recovery from SARS, flus, and other coronaviruses can take a long time, even in normally healthy populations. Yep, getting sick still sucks, and your immune system having been suppressed for the last 5 months probably hasn't helped either. They go on with the facts. The CDC reports that previously 1 in 5 previously healthy young adults weren't back to their usual health within 14 to 21 days after testing positive, while 90% of people with influenza recover within 2 weeks of a positive test. Here's another simple revision by changing all those numbers into a similar format. The CDC reports that 80% of normal young people were recovered by 3 weeks after testing positive for COVID, compared to 90% of normal young people feeling recovered by about 2 weeks after testing positive for a flu. Yup. Sounds like about 10 to 20% of people who catch a respiratory flu still don't feel back to normal after about 2 to 3 weeks. But let's try this doozy out. We're learning more about this novel virus every day, but lung damage, heart damage, blood clotting, and other long-term problems are being seen in some former COVID patients. You mean people who get sick can have other issues like, what's that fancy word, comorbidities? They infer science when they say they're learning more about the virus, but then defer the science of correlation versus causation by the end of the very same sentence. And did you notice that they didn't actually address the myth? This is important. That's because they can't figure out how to insinuate that every case matters. Because later on, they want to infer that the case numbers need to be 0 before we are safe. The fact is, if case numbers for COVID are so important, then we need the same aggressive testing for the flu, because we have seen the same short and long-term side effects, and gosh darn it, still more deaths month over month from the flu than COVID. Why are y'all letting public health get away with this stuff? I mean, first they try to tell you that open means closed. Then they try to tell you that covering your face means you care, which is oh so scientific. And now they seem to think that you can't figure out that 1 in 5 is the same as 80% when compared to 90%, and that doesn't seem like a newsworthy statistic, does it? Listen, you guys are being sold a bunch of lies wrapped up with a pretty bow of a tiny bit of truth. It is time to hold your health services to a higher standard. It's time to have your politicians who appoint your health and human services to a higher standard. And if you haven't already, it's time to take off your mask and say something about it.
Another promise, another seed.